At SafeWork New South Wales, we support the healthcare and social assistance sector to provide safer work, safer care. Our priority is preventing injuries, and we do this by working with businesses to ensure they meet their obligations under work health and safety laws. If you are a service provider or a host employer of subcontractors or agency workers, you have a primary duty of care under the Work Health and Safety Act.
This means you must do what is reasonably practicable to ensure the health and safety of workers, including volunteers. A typical workplace might be an office or healthcare facility, but also includes a participant's home if that's where the work is done. Psychosocial hazards are aspects of work and situations which can cause a stress response and lead to physical and psychological harm. Stress is that physical and emotional reaction a person might have if they feel the demands of their work exceed their ability and resources to cope. Stress itself is not an injury, and we all get exposed to it. Work-related stress, if prolonged or severe, may lead to psychological or physical harm. Some common psychosocial hazards in the disability sector can include excessive workload or expectations from employers, managers, participants or others at the workplace, a lack of role clarity such as poorly defined job roles, responsibilities or reporting structures, and the conflict these might give rise to, exposure to workplace violence and aggression, poorly managed work relationships which might involve inappropriate behaviours such as bullying or sexual harassment, or conflict with supervisors or colleagues. Vicarious trauma, where workers are put at risk from repeated or ongoing exposure to other people's trauma. Poor support from managers, supervisors or peers. This may include working alone or in an isolated environment like someone's home. Workers who are psychologically injured at work on average have 4 times as much time off work than workers who are physically injured. Psychological injury cost impacts are also far higher for businesses, for workers and the community compared to other injury types.
SafeWork New South Wales has developed a code of practice which outlines how to manage psychosocial hazards at work. This code is an important tool for employers and other duty holders as it explains how to comply with the work health and safety laws, including how to identify and manage psychosocial hazards. For employers, having safe systems of work to manage psychosocial hazards can help you meet your legal obligations, decrease the incidence of harm to workers, minimise disruptions to business as it provides care and essential services, improve workplace culture, especially if workers feel supported in raising issues or concerns and can see that positive changes occur to create a safer working environment. It's important that controls used directly address psychosocial risk factors identified. If it's to do with workload, conduct regular work reviews to ensure caseloads are manageable and streamline processes to create efficiencies. During peak periods, prioritise work to make it more manageable. Regularly review staffing levels to ensure an appropriate skills mix and staffing pool. If there are issues with task or role clarity, clear job descriptions with supporting policies and procedures can clarify responsibilities. This can reduce the likelihood of conflict. If violence is the hazard, ensure information about your participant's home and history are considered when developing care plans. Ensure there is appropriate consultation and communication with transfers or handovers to better understand possible behavioural issues, potential triggers and management of these. In serious cases, services could be modified or refused until risks are eliminated or minimised. Having policies and procedures for managing internal conflict or inappropriate behaviours such as bullying or sexual harassment and using them. To minimise the impact of vicarious trauma, provide planned job rotation to allow recovery time from exposure to traumatic experiences of others.
Whatever the psychosocial hazards might be, you can always provide additional support to workers, extra training if required, and address raised issues promptly and fairly. Consultation is a legal requirement and an essential part of health and safety risk management. So make sure you consult with your workers regularly and follow up on any issues that are raised, as well as asking how risks might be controlled. SafeWork New South Wales has resources and tools available to support you to understand your work health and safety obligations, as well as how to create a healthy and safe workplace. Contact us today for assistance on 13 10 50 or visit our website to learn more. Together, we can help you deliver safer work, safer care.